Takayasu arteritis is a disease characterized by large vessel inflammation, typically involving the aortic arch. It can be a little tricky to keep the different vasculitities straight, so let's take a stroll down to our local takeout joint and drive the facts behind Takayasu arteritis home. After a long day of studying, nothing quite hits the spot like getting a tasty meal from my local takeout restaurant. Let this takeout remind you of Takayasu. Takeout for Takayasu. Get it? Yeah, here we are. I've been ordering from here for years, and they always serve food in these cute takeout boxes. We're now looking into the kitchen of this takeout restaurant, which should anchor you to the scene on Takayasu arteritis. This takeout joint is nothing fancy, just a little hole in the wall. They try to make you feel right at home, and their thoughtful decorations reflect that. Check out this painting of the ocean on the wall. You know how you always see this painting on the wall of takeout restaurants? It always reminds me of how expansive and large the ocean is. Coincidentally, since the ocean is a large body or a large vessel of water, it also reminds me of the fact that Takayasu arteritis is a large vessel disease. Yeah. Let this great body of liquid remind you of the fact that takeout, Takayasu arteritis, is a form of large vessel arteritis. In addition to their large vessel artwork, take a look at that bonsai tree. This is one fancy tree with a unique bend or arch. Wait a minute. Let's take a closer look at that arch. It has a very aortic quality to it, doesn't it? Let the arch of this masterfully cultivated bonsai remind you of the fact that Takayasu arteritis most commonly affects the aortic arch and its branches. Arch for the aortic arch, right? Here at my favorite takeout place, I always make a point of saying hi to the family. They know me here. You could say I'm a regular. Whoa, what's going on? Is she okay? It looks like the head chef has fallen to the floor. Yeah, she's the daughter of the original founder who recently started running this restaurant. She's new and much younger, which helps me remember, well, a young woman. The typical patient with Takayasu arteritis is an Asian female under 40 years old. Just remember that the daughter has recently taken charge of this family-owned takeout restaurant to remember the typical demographic for Takayasu arteritis. I hope she's okay. It looks like she might have hit her elbow in that fall. Man, that joint must be in a lot of pain. By the way, this painful elbow should remind you of the arthralgias and joint pain commonly seen in Takayasu arteritis. Picture this young woman who has injured her elbow to help you remember young Asian women and joint pain. This image alone might help you take out a few extra points. You know what I'm saying? Thankfully, there's always more than one cook in the kitchen. It looks like our more experienced granny knows what to do. By the way, this granny is our recurring symbol for granulomas, also called granulomas. Granny, granuloma, get it? Granulomas are a common pathological finding in Takayasu arteritis. If you take a biopsy of a large blood vessel like the aorta, you'll see inflammation with granulomas. Technically, granulomas are focuses of chronic inflammation consisting of a lot of macrophages surrounded by a collar of lymphocytes. These are called granulomas. Remember Granny here in the hot kitchen, and you'll never forget the inflammatory granulomas seen in takeout arteritis. What's this? It looks like Granny knows her BLS and is checking for a pulse. This pulse checking helps me remember that Takayasu arteritis is sometimes called a pulseless disease. You see, patients with Takayasu arteritis can have diminished pulses in their upper extremities. This can make it appear as if patients are pulseless if you only check the radial or brachial pulses. So how does this pulseness happen anyways? Well, granulomatous inflammation of blood vessels can result in intimal damage, formation of blood clots, and fibrosis, all of which contribute to subsequent vascular narrowing. This narrowing leads to reduced blood flow, which can lead to difficulty detecting a pulse from vessels downstream of the inflammation. Remember how we said Takayasu Arteritis typically affects branches of the aortic arch? Well, involvement of the 3 branches can lead to decreased blood flow to the upper extremities. In short, patients with Takayasu Arteritis can have markedly diminished pulses and low blood pressure in their upper extremities. Let this medicine-savvy grandma checking for a pulse remind you of the pulselessness of Takayasu Arteritis. But now back to the grandma. See those dark sunglasses? Time hasn't been kind to her, and old age has taken away her sight. You know the classic trope of the blind Asian granny who happens to be a master of Eastern medicine? Yeah, that's what we're going for here. Anyways, let's use these darkened shades to peg the ocular disturbances seen in Takayasu Arteritis. There's a lot of reasons for ocular involvement in Takayasu Arteritis, but the easiest explanation is that blood supply to the eye may be compromised due to involvement of the aortic branches that supply the ophthalmic artery, leading to, ocular ischemia. And ocular ischemia is not good for your vision. Don't forget this grandma and her stunning shades to remember that vision problems can be seen in Takayasu Arteritis. Nothing beats the smell of spicy peppers, ginger, garlic. Wait, is that something burning? Check out that flaming wok over there. They work with open flames to release the flavors of the food. Because it's incredibly hot in here, I'm already sweating. Let these flames remind you of the fevers and night sweats associated with Takayasu Arteritis. Fevers and night sweats are nonspecific findings seen in many systemic inflammatory diseases, so it's not super helpful for narrowing the diagnosis. However, they can point to something systemic going on. I can't imagine having to work in such a hot kitchen. It must make you so sweaty. On the note of nonspecific clinical findings, take a look at the countertops in this restaurant. Yeah, see this front counter here? It's this beautiful red granite, which has all these red sedimentary lines. For some reason, red sediment makes me think of erythrocyte sedimentation, as in the erythrocyte sedimentation rate, or ESR. Yeah, this red sedimentary counter is here to help you remember that elevated ESR can be seen in Takayasu Arteritis. ESR refers to the sedimentation of red blood cells in the lab, and it is a nonspecific marker for inflammation in the body. That's right, ESR is a surrogate for inflammation. So while it isn't specific for Takayasu Arteritis, if you see an elevated ESR in someone of Asian heritage in the question stem, make sure to think about Takayasu Arteritis. All right, let's get back to the kitchen. Wait, hold up. Who put the paper lanterns above the flaming wok? I'm no OSHA expert or safety engineer possibly, but that seems like a pretty bad idea. Yeah, notice how those lanterns have caught fire from the wok, and how the fiery lantern looks kind of like an asteroid hurtling through the kitchen. Let this asteroid-like lantern remind you of the treatment for Takayasu, corticosteroids. Asteroids for steroids, right? Corticosteroids are a general anti-inflammatory drug used to treat a lot of other vasculitides, so this should make sense. Phew, it's been a crazy day at the takeout shop. Although I never did get my General Tso chicken, I got something better. I learned a lot about Takayasu Arteritis. Let's recap quickly so I can get out of this sweltering kitchen. Takayasu Arteritis is a large vessel vasculitis that classically affects Asian women younger than 40 years of age. The vasculitis typically involves branches of the aortic arch, and reduced blood flow to the upper extremities can result in diminished pulses, which is why the disease is also called a pulseless disease. Other clinical findings include joint pain, fevers, night sweats, and ocular disturbances. Biopsy of blood vessels will reveal granulomatous inflammation, and laboratory findings include an elevated ESR. Treatment includes the administration of corticosteroids. It turns out that the owner is okay. I'm so glad. I just love this takeout restaurant. Anyways, just come back to this sizzling scene and you'll never forget Takeout Arteritis. Onwards.